Hello and welcome to Health is the Key. I'm Dr. Karinn Glover, and I'm here to introduce this special replay of my podcast episode from March 2024. Take a deep breath. Elizabeth Moore, the host of this podcast, is on leave and will be back with a new episode next month. In the meantime, take a listen and let us know what you think. Our conversation touches on the unique stressors that healthcare workers face, the symptoms of burnout, and the right time to ask for help. I hope this episode leaves you informed and hopeful.
Hello, and welcome to Health is the Key, a podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore, and today we're talking about something that has become all too familiar. Are you feeling burned out? If you are, you're not alone. A recent study found more and more healthcare workers are experiencing burnout. So what exactly is burnout? A quick definition. Burnout is a state of emotional, mental, and often physical exhaustion brought on by prolonged or repeated stress. Often caused by problems at work, burnout can also appear in other areas of life, such as parenting, caretaking, or romantic relationships. If this sounds familiar, we are so glad you joined us. Today we're talking to Dr. Karinn Glover, attending psychiatrist in the Adult Outpatient Psychiatry Division of the Montefiore Health System. Dr. Glover is going to help us explore what has become a burnout crisis among healthcare workers and share important information on how to recognize warning signs and what we can do to improve our well-being. Welcome, Dr. Glover, to Health is the Key.
Thank you so much for having me. I'm really happy to be here.
We're so happy to have you here. In your experience, and we're sure you've dealt with a lot of healthcare workers experiencing burnout, how is job stress different for healthcare workers than for the average worker?
So healthcare workers face numerous challenges that maybe the rest of the population does not face. For example, life and death situations, patients' families that are also coming to them, and there's this constant need for compassion, for empathy, and sometimes not much space to replenish oneself during the workday.
Healthcare workers are committed. They're caring for humans.
Absolutely. Mm-hmm. And so one of the things that compels us to get into the profession at all is to be of service. Mm-hmm. And sometimes burnout occurs when the desire to be of service is met with obstacles that prevent us from sort of enjoying the work more and having the space to do a little bit more of the other things that would also bring us joy, meaning either teaching others or being able to take adequate amounts of time that we would want for reflection or for even being of service to other folks' families and loved ones.
I think many workers wouldn't know that they're experiencing burnout, so they just think it's part of the job. So how can we help them recognize the symptoms or signs?
So the biggest things that jump up whenever we're having conversations about burnout are you losing sleep? Are you just constantly feeling like you are on? When you are at work, are you able to focus? And do you still feel like your work is valuable? When you start to feel like your work is non-essential, when you feel like it's inconsequential, that whatever you do, it's not going to make a difference, I think that's when you have to start paying attention to things like burnout. Mm. And when you start to feel like, especially in healthcare, that each patient is a number or that they are not fully human and that you don't have space for them, that's when you really have to start asking yourself questions and maybe talk to somebody.
When you start losing sight of the thing that brought you pleasure.
Exactly. When it's no longer fulfilling, mm-hmm. when you don't feel like a full human, when you don't feel like the patients are fully human, and when you start to feel like you're just a cog in the wheel and that you are unable to give the kinds of empathy that you got into this for, it might be time to think about how you're doing.
And I think it's because of the nature of the job, so many healthcare workers think, well, I just need to push through this. Can you explain a little bit about why pushing through doesn't work?
Sure. So I will say sometimes pushing through does work, right? That if you are a surgical tech and you recognize that you're kind of mentally exhausted, but that you know you only have 40 more minutes left of this surgery. Push through, right? But if you're in month 3 of feeling like you can't do this and you've been pushing through, it's time to take a moment and sort of reassess because the brain, like any other part of our body, is meant for work, but it's also meant to rest. And if you get to a point when you will not give yourself the kind of rest that you need, and I'm not just talking about getting a solid 8 hours of sleep, because sometimes you get to a point where that's not enough. Sometimes a person needs more rest, more of a change in the kind of work they're doing.
Mm-hmm. And you mentioned seeking help, like when you recognize that this has gone on long enough, I need help. How do you realize I need to do this for myself, for my patients, for my loved ones? How do you go about first finding someone who you feel comfortable with and can speak to, and just finding the time to make me time?
Those are so complex and yet very, very necessary questions. So let's start with, how do you even know? Or when you know, what do you do? So how do you know? If you recognize that your sleep is affected, that you're snapping at your kids, you want to kick the dog, you find yourself yelling at strangers in traffic more often than usual. But when it gets to that point where you're kind of ragey all the time or feel sort of flat or empty inside more often than not, then it's probably time to look at your benefits. You may want to get an appointment with the EAP specialist because that's private and because there is an ease sometimes with how you can land an appointment through the EAP. It may happen sooner than later. So that's another option.
And just for clarification, what is EAP?
EAP is Employee Assistance Program.
Got it.
And usually most larger employers have something like that where they make it easy for a person to connect to mental health services or substance treatment services with a certain amount of ease. You get a limited number of appointments, but you get them quickly, within days, sometimes within a week, sometimes within 2 weeks. If you know that you might be open to longer term treatment and you might want to sit down with a therapist on a regular basis, you can check your benefits, see who's in your area, see who's doing tele appointments, and by tele I mean telehealth appointments. And I think the thing to figure out is if their hours work with yours, right? We know that some people work at night and their availability is limited during the day. Some people work during the day and the availability of the therapist is limited in the evenings. So figuring that out can take time, and sometimes there are wait lists. But most of the time, as somebody who loves being in the mental health profession, I want to say almost all the time it's worth it to look for that kind of connection.
One of the major stumbling blocks is the stigma surrounding mental health, that despite all our awareness, it still continues. So how does a person get past that? And a two-part question, once you do, and you do approach a mental health professional, what do you look for in a mental health professional? Because it's so hard to know, who am I going to be comfortable with to tell my deepest, darkest secrets?
The best thing you can do is start with whoever can see you the soonest, right? I think because popular media and entertainment shows psychiatrists as the go-to person for therapy, I feel like it's important to say psychiatrists are in high demand. We're really hard to find, and we may not have the time or the skill set necessarily to do therapy. Psychiatrists are folks who have gone to medical school and are usually very well versed and likely to prescribe medications. So if you don't think you want to start with medications, I would urge you to think about seeing a licensed clinical social worker, LCSW, or a licensed mental health counselor, a licensed marriage and family therapist, for example, because some of those folks are very well versed in how to provide therapy, psychologists as well. But then, of course, it comes down to, what are your needs out of therapy? Do you need something that is open-ended, where you talk for however many years you want to and think about your childhood and whatever comes up, and your therapist is trained to listen in a certain way to help you problem solve? Or do you want somebody who says, look, you have 12 visits. Why don't we figure out what your goals are for these visits? I bet I can have you feeling better in 7, but you will have to do homework in between visits. You will have to come back and you will tell me what you've tried, and we will gradually take a look at your automatic thoughts, and then we will sort of rewire your thoughts and beliefs and behaviors so that you can create the life that you want.
How do you know which is going to work for you? So basically, like, what do you ask? What do you look for in a therapist that, no, okay, I'm going to click with this person, or, oh, no, this is not for me?
Those are such great questions, right? So all of the folks that I described are therapists.
Okay.
So the thing that has helped lots of people figure out what kind of chemistry they will have with the therapist is sort of found in usually the intake process, is sort of the first appointment you have with the person. And you can look at their profile on Psychology Today, for example, psychologytoday.com, that has beautiful listings of and lots of therapists, right? And you can look through some of their qualifications. And if you say, well, here are my biggest issues. Work is hard. I feel burnt out. And I've got to take care of loved ones. I've got an elder at home who I am a caretaker for. I feel like I'm always on. And on top of that, I've begun drinking a little bit more than I want to. So when you look for the right kind of therapist, you look for somebody who has experience in substance treatment. You want somebody who is schooled in, say, motivational interviewing, who's going to say, what do you want out of a life without alcohol or a life with less alcohol? It's a wonderful tool for engaging people about behaviors that they want to change. And so it's this very direct, very, like the name implies, motivational process where you say, you know, look, I want to exercise more, but I find that when I get home from work, I'm super tired. All I want to do is I'm hungry. By the time I eat, I feel like I can't do anything else except sit in front of the television. Well, the person who's schooled in motivational interviewing will start off by asking, well, why do you want that? Why do you want more exercise? What is it going to do for you? And by sort of teasing out what your motivations are for your work and then teasing out what the barriers are, you have a very explicit conversation about how to get closer to your goal. And you set reasonable goals.
Say, let's take a 180 from there. Say you don't want to, or for whatever reason, stigma, or you just don't feel you need it, and you want some DIY.
Or what do you do before you can get the appointment?
Yeah.
Because sometimes there's
Right.
wait lists. Yes. The first thing to do is to prioritize self-care. And what does that look like for each person? It's different, but it means maybe asking yourself the following questions. What brings me joy? What brings me relaxation? What brings me pleasure? And what's going to help me sleep at night that maybe doesn't involve Jack Daniels, right? And making time for that and being very, very intentional, and maybe even asking for help from loved ones to just say, you know, I need help to just make sure I take a walk in the sunshine. I need vitamin D really badly, so I need somebody to watch these kids. Like, you kind of have to do it. Like, just, there's no two ways about it. I think also overcoming some of the cultural judgments and things we've inherited perhaps from our cultures is really important. So I'll give an example of something that I went through when I was in medical school. I was tired. I was studying all the time. I was working long hours, and I would feel like, ugh, I'm tired. But how dare I be tired? My grandparents were farmers. My great-great-grandparents were actual enslaved people. How dare I complain about anything? And then I had a shift. What came to me was, if anybody wants me to relax, it is the people who were not allowed to relax in the past. That maybe my relaxation is not only for myself, it's for the relaxation that they didn't get to have. Right?
That's a great point.
Yeah, thank you. That it doesn't mean I'm a lightweight. It means I've listened to their stories. I've listened to their traumas. I'm doing good work in the world. Why not relax? So that's one thing. And I think for our friends and family members and community members who come from immigrant backgrounds, there is also this sense of guilt, right? If you know that your parents sacrificed a lot, or if you know that you sacrificed a lot to get to this country and you're living out a dream or a goal that you had as a child or as a young adult, you may feel like, well, relaxing is such a shift from the struggle that I had previously embraced and had gone through to get here. How dare I relax? Well, I would invite you to say it's time to shift your thinking, because you are not a machine. You are a human being, and you are very much entitled to rest. And then also making sure that you connect with your loved ones in the most joyful ways possible. So, for example, I remember when I was a kid, we would have family parties, and all the adults would make all the kids dance. And we would have to dance in circles, and we would sort of have to delight our elders and listening to James Brown. And I look back on that with a twinge of embarrassment, because, like, how dare y'all make us dance? But also, there was so much joy in the room. And I think about how intentional our families were and people in our community were about creating joyful spaces for a very low price. It didn't cost much to turn on the radio and dance.
I love that you talk about the small things, like how easy it is to do. You know, there are simple things all around us that we can do every day to bring us back to ourselves.
Yeah, I think that that's super important to keep in mind, that the grand gestures are beautiful. I'm a fan of vacation and going away. And yet, in between those vacations, I've got to do some things to maintain myself, maintain my mood, be very good to myself with nutritious foods, expanding my palate to accommodate said nutritious foods. So making sure you bring a nutritious lunch. You'd be surprised what it can do for your mood and what it can do for your sleep. And simply how you can, as you start to shift your perspective about your burnout, how in some ways the world will rise up to meet you in that challenge.
So many of us overlook the importance of good nutrition and sleep. We think that's indulgent.
If there are ways you can get more sleep, please take advantage of that. And if that means using a white noise machine so that street noise doesn't wake you up from rest, if that means you have to go get screened for sleep apnea because your partner says you snore really loud and sometimes you're struggling to breathe, please go talk to your primary care doctor about that. And be insistent. I've noticed sometimes that when we're at the doctor and we tell the doctor what our concerns are, and as a physician myself, sometimes people tell me things and I'm sort of like, that doesn't seem that important. But then I have to stop and say, how important is this to you? And when the patient says it's really important, well, I have to do something, right? So it may mean a referral to a specialist, but check on your sleep, check on your energy level, check on your mood. And if you want to keep a log of your sleep, your appetite, your mood, your energy for a week, just literally Monday, what's my mood like? What's my energy like? How was my sleep the night before? And just look through the week. If you know you have sad faces in most of those categories for the whole week, it's time to reassess. One thing that I always try to pay attention to is whenever I'm giving advice or asking somebody to think about a behavior change, I always have to think about the structural factors that may pose as challenges to the behavior change that we're trying to make. So if I know I'm telling you to exercise, but you live in a neighborhood where there's no green space, then I want to make sure that that's a conversation we can have openly. So for members who live in places where there's not a lot of green space, I would humbly suggest that you be very intentional about maybe on your way home from work, stopping at a place where there is green space. And I recognize that some of these things are systemic factors, and these are real things. So when it comes to things like that, when I know that you are a person who wakes up and goes to bed every day in a black body or a darker skinned body, and that being in public in certain neighborhoods in the evenings can result in perhaps unfair scrutiny from people around you or feeling unsafe. I want that to be something that you get to think about openly and you get to talk with your clinician about if that comes up. And if you're a woman, I think it's also important to pay attention to the fact that often patients have different expectations of you, that even your colleagues may have different expectations of you simply because you are a woman and you navigate the world with certain levels of expectations that the world does not necessarily have for men. So I just want to bring all of those things up, that each plan for addressing burnout can involve systemic factors and sometimes bias, and that we need to be intentional about teasing some of that out so that you feel like you have a plan that works for you and the body you live in.
Mm-hmm. So there's extra work to be done no matter who you are, and you need to recognize them. Well, you've given us great information on getting professional help, getting DIY help, turning to others, taking care of yourself. We think that members can use this information to take control of their burnout instead of burnout controlling them. Well, thanks again. We appreciate your taking the time to be with us.
Yeah, this has been great.
For more information on what you heard today, please check our show notes. And remember to subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional, medical, or psychological treatment, diagnosis, therapy, or other types of professional intervention.